Okay. Well, welcome everyone to Redemption and Restoration Fellowship Church, to our Thoughtful Thursdays. And we don't want to prolong things. So we want to present Dr. Katrina Stozier Md. We want to welcome her today, and feel free to ask any questions.
Hello, can you hear me?
We can.
Yes, I can hear you.
Okay, awesome.
Yeah.
All right. I am so honored to be here to talk with you all a little bit about COVID today. As an OBGYN, I have seen lots of my patients that have had COVID, but I've also seen a lot of pregnant moms that have it. When we're looking and thinking about how diseases affect our population, I think when we go back and look at the beginning of all this, we kind of were taken over by storm. We heard a little bits and pieces. You heard things that, oh, there's this really bad respiratory virus that's over in Europe. Oh, it started out in Asia. We really didn't have, from a medical community, the tools we needed. This thing came in, and once it hit America, it took us by storm. We didn't have the resources for testing. We didn't have the resources for treating. We were trying to gather information. When we think about any of the other pandemics and other illnesses that we treat as a medical community, it was very different in comparison to when we found out about Ebola and other things. You didn't hear about people being sick and the numbers and the losses and the long-term effects. So it was really difficult for even a lot of us providers. We pride ourselves on education. We pride ourselves on being able to take care of people. We pride ourselves on being able to even educate. But most importantly, we didn't even have the testing. You can't treat what you don't know, huh? So we started having to really pull on other countries. We're talking about incomplete research projects, incomplete data to manage, to try to even figure out how we were handling patients. And we were getting new information every day. It was just, I had not seen anything like it. It was mayhem for us. And some of the arguments and things that we would hear, oh, well, why didn't they just shut everything down? We didn't know enough about how things were working. When we look at how other, like I'm telling you, when we had H1N1, this was I think H1N1 for my medical profession, probably we lost a lot of lives of flu that year. And I saw pregnant moms sick during that time with H1N1. And I mean, the testing, we still could do a flu testing at that time. We didn't even have testing, but we did have medical literature. We look at how government affects the education of our providers. When we look at how our national government entities distribute information that is helpful for our patient population, when it came to H1N1, when it came to Ebola, when it came to other major illnesses, I would get information from the CDC. We would get information from the NIH. I mean, we would have so much information printed as well as emailed. When I look at how COVID came and shocked America by storm, we felt the least prepared as any other thing we have dealt with. So from a provider taking care of patients, it was hurtful. It was hurtful how it came in, but you know what? There are things that are definitely out of our control, and that's why, we have to stay spiritually grounded and rooted. I'm grateful when we do know better, that we do better, and that we try to still help people. We know that hundreds of thousands of lives were lost with COVID. And for that reason, people stayed home. We had our national lockdown that, for a long time, people thought COVID in itself was a myth. It took about 6 months for some people of color to believe that such a virus existed because they had not seen it hit their city yet. They had not seen, they thought people were making up these symptoms. They thought people were fabricating this. I think when we are looking at how our perceptions of healthcare are, our perceptions of what we believe and don't believe from the media, because there was such a distrust of, was this even a real virus? A lot of people didn't believe it and therefore did not take certain necessary precautions. And therefore, a lot of people of color were affected by it when there were certain guidelines that were printed out. Oh, no, it's no virus. They're making it up. No, we got a lot of people that lost lives. We also have to look at how how the virus affects people. Which people are most at target? Are Black people of color most at target because they're Black? Or is it also because of other comorbid conditions that are occurring that are more prevalent in our community, such as high blood pressure, diabetes, obesity, um, and other respiratory illnesses? We might have a higher incidence of asthma based on maybe risk factors, or maybe you inherited these things. So if you were to contract a respiratory illness, you already had some other risk factors that make it a little bit more difficult to fight. As far as the origin of COVID, I'm not here to debate where it came from, how it came from. All I know is we needed to treat it. And however that meant, if we see wide range, you have mild cases to moderate to severe and a lot of deaths. But to know that in our country, 70% of the deaths were people of color meant that it was harming us and was killing us at alarming rates in comparison to other nationalities, which is a reflection of our system. Could it be access? Could it also be the fact that we really pride ourselves in trying to fix our own bodies? I'm gonna try everything before I go to the hospital. Nobody really wants to go to the hospital. But we gave strict guidelines on if you're having these symptoms, you're at higher risk of dying. If you are struggling to breathe, you have got to get to the hospital. And I definitely want you to hear from my uncle. We walked through his journey, and I'm so grateful he listened. But I take care of a lot of patients, and depending on where you are, depending on what kind of healthcare access you have, depending on what your family says, I have a lot of patients who are just very still mistrustful. They don't trust the healthcare system. And we know from people of color why that happened. We look at Tuskegee instruments and all, that really harmed a lot of people. Even if people didn't know about it, a lot of kids hearing about it later as they've grown up, reading the story about that Tuskegee, um, that whole experiment. It was just, it's hurtful. A lot of the stuff that we've learned through medical science did involve experiments on people of color. However, we do have a lot of laws and safety um, put into play to ensure that we don't have these types of things happening. However, it's going to take, just like it took years to get people to trust the medical community again, we are still fighting those uphill battles. But we can only do it if we are changing our mentality and our focus and trusting God for our own health. Um, we are so grateful that there are 3 vaccinations that are offered. Originally, we started out with adults that could get the Pfizer and the Moderna. The Pfizer being a 2-shot that you would get 3 weeks apart, and Moderna 2 shots. The second one getting 4 weeks apart, and then you also have the Johnson Johnson that's come up. Most people that get these vaccinations have minimal symptoms. Most commonly, people complain of pain or soreness at the site of the insertion, and usually it's in an arm, a muscle group. similarly to if you got a flu shot or any other vaccination. Other symptoms that people complain of when they get the shot is some might get a headache, some might get a little fatigue for a day or two, and rarely has anybody had such severe reactions that ever ended them in the hospital. There were some questions in the early phases of the wide distribution of vaccinations that people in the 85 and up age group were being harmed and having such significant reactions that they were having a higher chance of dying. But we don't know. Was it chicken or the egg? Was it they already probably would have had something happen? They are 85. We all gonna die of something. Or was there real significance? And I'll tell you, there are probably some cases, depending on what the specific side effects that may have increased their risk. But I would say all in all, there are so many people in that older age group that by far and far are doing well with that vaccination. And still, my 91-year-old grandma was so excited to be able to get her vaccination. So I am just saying, for us as people of color, a disease that has affected 70% of all the deaths. When we're looking at the deaths, we're looking at the illnesses, to know that though 70%, when we already make up a less percentage of a general population, we have to be more vigilant. We have to trust the education, and we have to be grateful that God has given us the education and not be blindly foolish, but accept what does that God has a lot of educators, scientists, researchers, people that are touched by God, and embrace what we learn, embrace what is there, and not be afraid. In this life, God has not given us a spirit of fear. He's given us power, love, and a sound mind. We are not going to let anything on this planet shake what God has given us, our faith, but He also allows us to have that medical knowledge. You pray on it. If your decision is that you just, I have so many people say we got to die of something, but to me, this is like saying, I got to die of the flu, or I got to die of something that really, we can give you something to protect you. I guarantee you, if you knew that polio was rampant, kids died of polio. If you saw, because this was respiratory, sometimes people can't get an idea. They see you in the bed, they might hear you working hard. We've seen people have asthma attacks, and so-and-so did fine, or grandma down the street has COPD, but they still okay. So a little COVID is not going to hurt anybody. But it's the other things that you don't see that's happening internally to the body during COVID. It changes your blood. When we talk about pregnant women, we know that pregnancy is a state where you got one foot on the earth and one foot in the grave. They say that. But part of the changes that occur with pregnancy is that your blood thickens to accommodate for the blood loss at the time of a delivery. And for that reason, it puts pregnant women at a higher risk of developing a blood clot. You could also have a stroke after having a baby. So sometimes we put pregnant women on blood thinners. But COVID also changes the way that your blood clots. So the things that you don't hear about, okay, people are struggling to breathe, but you have a lot of other metabolic issues. It's attacking your lungs. It's also attacking the way your blood cells are forming to pass through your body. You can have a shutdown of your kidneys. You can have shutdown of your liver. It's a whole lot. And we're still documenting the long-term effects of COVID. Okay. And the thing is, you can't determine who's going to be at risk. I can look at it and say, they came up with at the beginning, if you had blood type A positive, then you were at the highest risk. If you had, sickle cell trait, they have a whole lot of lists of different things. But I'll tell you what, when at the peak of this thing, I would go to the ER, and the ER docs would say, I literally had a middle-aged person come in with some mild symptoms, have some risk factors, but they're actually doing okay. But then I have a 22-year-old started having symptoms and within 3 days come in here and die. And my God, we don't know who's the sickest. They said they're either on death's door or they're really mad, and we're glad we can send home, but you don't know who is going to be affected badly. And so we have to just be mindful and pray for those who have lost their loved ones during this time. It's a lot of lives that have been lost during this time. We actually have a huge surge in mental health disorders during this time, being isolated. We also have to think about what impact did COVID play in our own mental health, our stress. It changed the work dynamic. People who were used to being out of the home were now in the home. And if you have children or a spouse who was now in the home, it completely shifted. It took you somewhere else. So you look at those stress levels. Most people gained weight during the pandemic. I'm about to say gain weight during the pregnancy, but I felt like a lot of people did gain. That was 9 months to a year and a half of isolation and stress eating and worry and what about these unknowns. But I think that when we look at those negatives, we also have to look at what are the positives we gained from it. And we learned a lot more, people spending more time with their families. So there were some things that actually felt kind of good that time. And then having to also restructure, all right, maybe I like y'all a lot, but maybe this is too much time together. So maybe let's create some new boundaries. It just made us look at things differently. However, I think all in all, most people would agree that we were forced to be more with our family, forced to be more present, forced to actually see what things we are really dealing with. Because when you're in that hustle and bustle of life, we have this place to go, this place to go, everything shut down. And then we figured out ways to still get people to communicate. And then I started hearing people say, oh, I'm busier now with COVID, with all these virtual meetings. Everybody thinks you should be able to attend everything just because you're home. That doesn't mean that you can attend more virtual meetings. And then it became more sedentary. So I think that some busyness is good, being able to stay mobile, being able to still participate in a virtual option when normally you would just completely miss something. I think businesses, I think churches, I think different social groups are going to find ways to still include people when they can't physically be present. And we probably have all found ways to interact and engage with each other differently. So the biggest piece, though, I did see a shift. People did start to say, hey, hello, can you hear me?
Yes,
Well, yes,
ma'am.
we can.
Okay, I just switched devices. Thank God for the second cell phone. I was getting to a place where I was kind of wrapping up, but really honing in on the fact that we don't know how your symptoms might affect you. We don't know if you might be one that just might have mild symptoms. You might be a moderate case or severe, or if you will actually lose your life behind it. Um, when we are knowing better, we've got to do better, and we've got to trust the medical literature, the medical community that is working on this. We have people that are Christian-based, that are faith-based, that have given their lives to research and to looking at ways of helping people. And so when we are being fearful, we are not walking in power and trusting God in the medical knowledge and the extension of Him. I'm not saying that God doesn't provide us miracles every day. I'm not saying that you should believe your doctor with everything they say and just go 100% in. You should have your education. You should have informed consent, and you should make good choices. But everything should not just be completely dismissed, or we should not believe myths and man over some of the most important education that's being done, the research that's being done. So we've got to trust God, thank God for what He has provided. If we, we have our own things, but we listen to our gospel music, we listen to secular music, we listen to a lot of different things. we allow what comes into our spirit, but we have to also trust when there is sound advice, listen to it and receive it, pray on it, and trust God with being good stewards of our body. Okay. I was saying I don't know if we've heard from Uncle Corky and his testimony yet before I got on.
No, he hasn't. He hasn't given his testimony yet.
Yes,
So,
but he can go ahead and give his talk, and then after he talks through his journey, I do want to spend some moments really talking about how pivotal it is to advocate for yourself. And I'm grateful that we have a resource, but everybody doesn't have adequate family resources to help fight for them when they sometimes feel like they can't fight for themselves. But I'll turn it over to him.
And everybody here?
yes.
Yes.
God bless everybody, and God bless my niece, my daughter from afar. I am a COVID-19 ICU survivor. At one point, I was only breathing 10% on my own, and they told me that I was closer to being put on a ventilator than I wasn't being put on a ventilator, and that was Mother's Day. And I can remember talking to my wife, and then I called my niece, Katrina, Dr. Strozier, and I started talking to her, and I started letting her know what was going on. And I can understand the anxieties that we have, you know, being a nurse's son. Our mother was in the nursing industry for years, and we read her books, we listened to her, we watched medicine evolve over the years. And so we've always had a respect for the medical profession because we've seen the medical profession do more good than not good. I am, once again, I'm a survivor. I talked to my niece. I thank the Lord for that resource. I talked to my sisters, Shalane, Felice, and my wife, my intercessor, my prayer warrior. The things that I had to deal with were more so not so much in my body as it was psychologically, because they said that if you're stressing psychologically, then it kind of stresses your healing process. So I would call my niece, and my niece would call me during her busy schedule, delivering babies and surgeries and things like that. And she would ask me, she said, well, I'm going to talk to your doctors. And so anything that's going on, put me on the list so they can call me and I can find out exactly what's going on with your treatment, how you're doing. And that was, to me, a consolation to help me just relax. But the processes in which what they were telling me, they just kept telling me, fight. And, I've never spent a day in my life in a hospital other than probably when I was born. But other than that, I've never been in a hospital admitted for anything. And for the first time in my life, I went to go get tested. And see, I guess they would call me a essential worker because I drive a truck. I deliver a lot of places. I drive locally. So I'm in and out of hospitals. I'm in and out of schools. I'm in and out of doctor's offices, in and out of stores, in and out of any place you can think of. We even deliver medical supplies to your medical distributors. And so anyway, to make a long story short, they were telling us to get the shot. And so I kept procrastinating. And a lot of the guys were getting the shots. A lot of the people weren't getting the shots. But then, I thought about when I started elementary school, before I started elementary school, as what Dr. Strozier was saying in the beginning, we had polio, we had measles, we had mumps, we had all those things that most people today that have to deal with the pandemic never dealt with those pandemics because those pandemics are like 70 years old, 75 years old. And a lot of America today, the millennials and things like that, they never really had to deal with vaccinations and deal with pandemics. So this is really the first pandemic that they've ever had to encounter in their young lives. But I can remember they wouldn't let us go to school unless we had immunizations. I don't know how many people remember that, but
Oh, yeah.
you had to have shot records in order to go to school, because they wanted to make sure that whatever um, viruses and whatever sicknesses that were out there, diseases that were out there, that they have developed vaccines for, that everybody received those, so that we wouldn't continue to perpetuate a situation that would never go anywhere if nobody ever got the vaccines. So, I'm grateful today. And they tell me that, anyway, back to what I was saying. So the day I went into the hospital, I went in, they were just going to observe me overnight. It ended up being 20 more days. So I went in May 1st and I finally got out on May the 20th, but I ended up in ICU twice. And so, lost a lot of weight, but, I kept fighting, and I kept listening to my niece, which was my source of comfort, because she kept telling me the things that they were doing, and to just be still and allow the process to take its place, because she knew that what they were doing was right. Well, I didn't know that. So, I thank the Lord that I had that outlet, and not only that outlet, but a person that was actually in the medical profession to help me through it mentally, because physically, it didn't seem, it just felt like I couldn't breathe the whole time, but I didn't know to what degree I was breathing. But I thank the Lord today that I'm out, and that's because He had put people in my path to help me through this situation, because He already knew what was happening before I did. So I'm just thankful, and I'm grateful for my sisters, for the prayer warriors. I was thinking about something in the scriptures. It talks in Luke chapter 4, I believe it's like verse 23, I think it is, when they were given an account of Jesus, and even though He was the Messiah, they kept saying He's the carpenter's son. And then I can remember Him saying, Luke's account was saying that they would say, when He came to town, physician, heal thyself. Now that was kind of interesting to me, because they acknowledged physicians, and I believe that physicians are put on the earth to help uh, mankind over situations. And I believe that all that wisdom comes from the Lord, because, the Bible said the devil comes to steal, kill, and destroy. Physicians come to help and restore, and to, help the body be preserved until, the Lord comes for it. So, I'm grateful for physicians, but I do believe that everybody should get that shot. Because one thing that I've learned, and one thing that I've been looking at and just kind of researching, is the shot has saved more lives than COVID has. And if you look at the numbers, when they came out with that vaccine, those numbers begin to drop. And if anybody can say anything, you can go back and look at the elderly communities. They opened up the nursing homes, because they see that vaccine has helped and protected our elderly. And they are probably some of the most vulnerable people in our society, just because of their age and their frailties. But it has preserved their lives. So those people have learned, throughout life, that, vaccines are not here to help us. To hurt us. They're here to help us. And I would tell you that the vaccine has saved more lives than it has cost. So if I would say anything, I would say to everybody, I know pandemic is new to some people, but remember, vaccines have always been a part of American way of life. We just have not had a pandemic in years, but now they have, and the vaccines have been developed. And over the years, they'll continue to fine tune things, so that. And the reason that we don't hear about polio anymore, because people took the vaccine. The reason we don't hear about mumps anymore, because people took the vaccine. So they understand now what the process is, and we just have to get beyond our fears. And like everybody was saying, trust the Lord with all your heart. Lean not into your own understanding, but in all thy ways, acknowledge Him. He will direct that path. And I'm grateful and thankful for the grace of God, and for the physicians that have dedicated their lives to helping us through medicine and through prayer. With that said, thank you, Al. Thank you, Katrina. Thank you, Dr. Strozier. Thank you for all my prayer warriors. Thank you for the body of Christ. And most of all, I thank God for allowing me to be here to share His
Amen.
goodness and overcome, in Jesus' name.
Amen.
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 It is just so amazing to hear my uncle talk because, like he said, I was able to see him day in, day out. I was rounding on my patients, but I was also rounding on my uncle. And I would step out, and I can't say, right now, I think the biggest factor, a lot of patients struggle with that breathing part of it. Most people who ended up in a ventilator were either their lungs were so injured and they required that, or they just work so hard. When you cannot breathe, this thing, I said, Uncle, I'm looking at you. We had one day, that Mother's Day he was talking about, it was so pivotal. It was very pivotal. And, when he first got in the hospital, they said, well, um, most people around his age, you can go 50-50, but he's such a fighter. He has such a positive spirit. He's just a joy to be around. I think attitude is half the battle a lot when you're sick, finding those positive outlets. But when you're working hard and you begin to grow weary, this was a day that he was weary, and I'm looking at him, and he looked tired. He just looked exhausted. Every breath he was making seemed like a tug of war just to breathe in and out with this positive pressure he had going on. And I had never seen him look that bad. And being able to talk with the medical professional, the pulmonologist, as a niece, when you look at pandemic, when you look at COVID, families were kept out of the hospital, even though they were communicating. Me being able to see my uncle on a monitor, on a FaceTime, a video chat, and say, hey, we're looking really bad today. As a team of physicians, we round. But let's say I'm only on for 2 or 3 days. You get accustomed to looking at that patient. I can tell from day to day by observing, did this patient look better today or worse than yesterday? Well, when you switch, that next person is coming on. You don't get an idea of what's normal functioning for this patient. So you could have a team of nurses, doctors, other people that are involved, maybe respiratory therapists, physical therapists, that may change day to day and may not be able to pick up on those subtle nuances that this is getting worse. You don't have family members, which is different than pre-pandemic, in the hospital advocating. Yes, we have video chat, but everybody might not have a cell phone. The number of people that were dying without a family member at their bedside, number of people that were sick and fighting, or just talking on a video, I feel like I'm getting worse. I had to talk them off a ledge. I said, hey, Uncle, you got to rest. And they're saying, well, even our patients who are on ventilators, they have to flip and they have to rest 18 hours a day. He said, it's just making me feel like I can't breathe. I feel like I want to, he said one day, I feel like I want to take everything off and run out of here. I'm just getting worse. The treatment was working. However, the mind, the physical feeling of constantly being underwater, treading water and can't breathe, I had to tell them, give him what he needs to help him calm down. I have another really good colleague, and she's an internist, and she said, oh, this is the part where some people end up on a ventilator because they can't calm down. So, looking at being able to advocate, how can we calm him down? Tell me what he's getting. Going through that mark. Everybody doesn't have that in their family. So just making sure that if you have a family member in the hospital, a family member who's going through something, that you are finding out what's going on today. What are the things? Because from a medical standpoint, he was getting everything he needed. But when I'm looking at him, I'm seeing him fight a war. But what is that one thing? I just feel like I'm not getting better, and we needed to help him rest. Something as simple as, can you give him something to get a good sleep? This man is used to being up and out. Please help my uncle take a good nap. He said, I don't know what they did, but I slept the next morning. We prayed. That next morning, he looked like a whole lot better. He said, oh, I think I slept 18 hours. Niece, I don't know. I must have really needed that rest. But he looked much better. But something, I mean, the conversation could have gone very differently. I got on a flight and I prayed. I said, I'm not getting on this flight, and I'm not going to get back to Georgia and find out he's on a ventilator. So you figure out how you get my uncle to rest. And I don't care if he didn't ask for something to help him. He's too exhausted to know whether or not he needs something to rest. Put it scheduled and make sure he gets it. But having a family member to advocate when you can't necessarily go through the trenches and ask that, we don't necessarily know sometimes as a Black community what we need to say, how we need to form these words. But we get frustrated and say, I'm not getting better. But sometimes we don't even know how to be our best advocates for ourselves. So part of when we're speaking about our health, when we're speaking about how we improve, this is just a very important conversation as we're looking at building our trust in the medical community, having faith in the institution, making sure that we're trying to understand the recommendations for us as an individual and us as a community, trusting those things and trying to figure out how we make us healthier as a population. That's just some of the things that are really, really important as I'm speaking to community health issues. As gynecologists, yes, I deal with women and babies, but this conversation matters to everybody. So it's relevant, male, female, child, whatever the age. So thank you so much for this time to be able to talk about COVID, vaccination, hear a little bit about other people's journey with COVID, and really just take the time to get more of the facts and have encouragement to feel confident to go get your vaccination if you have not already gotten it. Thank you.
This is Karen. I've got a question for Dr. Strozier. And
Okay.
my question is, how much research has been done on this CRISPR?
On what?
The CRISPR.
What's that?
I'm not familiar with the CRISPR. I can get back with you. I can look it up outside of this, and if you can get your question to Reverend Al, I can definitely reach out to you when I get information. I will not sit on any panel or any discussion and tell you that I know something and give you any false information. But if I have a question that I can go in and research and give you information about it, I will get back with you on that if you allow me that time.
Sure, that's fine. I was just wondering, see, there's some of us that have heart disease. And so as a result, we're watching this CRISPR, which is supposed to help. Right now, the vaccine gives an inflammation in your heart. Well, for heart patients, that's not good.
Right.
So this CRISPR is supposed to help in avoiding that inflammation in the heart when the vaccine is taken. And so
Okay.
I'm wondering, how far along are we with this CRISPR with the vaccine so that we can take the shot for those of us that have critical heart disease?
Yes, I'm definitely not a cardiologist, and definitely those types of medical issues are important to consider when we are looking at who should and should not get the vaccination. I do know that COVID itself, though, however, is an inflammatory process. And if you already got risk factors, that definitely will precipitate. And from everything I have read, if you are highest risk, you probably are more of a candidate because the disease in itself probably will hit you harder than most Americans, more than the inflammation of a vaccination. So if the CRISPR is really meant to help decrease the inflammatory processes, it sounds like it's a good thing, but I will do some research on that and I will be able to give you a more definitive, more well-educated reply to your answer.
Right, and when will it be available?
Right. I'll get back with you on that. I'll find out. I'll have to do some background research on that.
Okay, thank you.
You're so welcome.
Excellent question, Karen. I didn't even know nothing. Does anybody else have a question?
Pastor Bradford, this is Pastor Mitchell.
Pastor Mitchell, hey, thanks for the Lord to have you.
Hey, I want to spell how it's spelled for the doctor so that she would know it's spelled a little different. It's spelled C as in Charlie, R as in Roberta, I as in India, S as in Sam, P as in Papa, R as in Robert. And they're calling it a vaccine enhancer, and they're still working on it.
Okay. Spell that again. C-R-I-N?
No, C-R-I as in India, S as in Sam or Samantha, P as in Peter or Papa, and R as in Roberta.
Oh, okay. Pastor Mitchell also works in a medical environment at the VA hospital.
Awesome.
A well-educated, respectful person. Glad to have you here. Thank you for that comment. Is anybody else online that has a question? If not,
I do.
Yes, come on.
I was wanting to know about the Pfizer vaccine, how long it lasts, or will we have to be revaccinated like within the next year, like the flu shot, or how long does it last?
So I think the guidelines are still being studied as to what the recommendations are. Is this going to be something that we get yearly like we do the flu vaccination? Right now, there have not been any strong recommendations for repeat vaccination. At this time, there was some talk about the Moderna may need a third vaccination, but I don't have any strong evidence that is recommending a repeat vaccination dosage as of yet. My thought is they're going to continue to, they're still taking samples and monitoring the initial sample sizes in the US for all those vaccinations that have already been put out, but they're still monitoring the initial patient population size, and they're taking their blood work periodically to see how long they have antibodies. So we'll get more information as it becomes available.
Can I get one more question and that's it?
Okay.
Okay, I'm an educator, and I'm around just our population head count this year is projected at 980 students, and we have an annual flu shot that we take, and I take the pneumonia vaccine, and I also take the shingles vaccine. If they said if we had chickenpox, we need to take that vaccine. And since I've already been vaccinated for COVID-19, is it recommendable that I still continue that regimen?
So the shingles vaccination should be a single administration. I don't think that you should change any guidelines as to whatever is recommended for you. You get what is recommended. But I think this brings up a really good point when we're talking about how does the COVID vaccination affect other things. One thing for me that came up a lot were women asking about getting their mammograms. Should they delay it? Because anytime you get a vaccination, you can get an inflammation. And because more people were getting vaccinations, and also while COVID was opening up, a lot of people had delayed getting their preventative services. We were seeing a rise in untreated and in a more advanced stage of cancer at the time of diagnosis, because during the shutdown, people were not getting their screening mammograms. They were not getting their colonoscopies, their pap smears, and other screening tests for those preventative. We want to catch get those early detection types of cancers. So we had patients saying, well, if it causes lymph node enlargement, I don't want to get my mammogram and they see an enlarged lymph node, then that's going to put me at a higher risk of them seeing something, and then I'm going to have to go back and they might have to biopsy something that may be a reactive lymph node. At this point, we did not recommend patients to delay getting their preventative services, because even if it's a reactive lymph node, even if you have to get a biopsy this year, the delay of a cancer, whether it's a month, 2 months, 3 months, 4 months, can be a matter of a stage 1 to a stage 3. So that's just a little sidebar. So no, keep your normal processes, get the information as to if you should wait a certain time period between vaccinations, and usually the people that are administering those vaccinations should have that schedule for you. But I have not seen it that you should prevent yourself from getting regular scheduled vaccinations just because you get the COVID shot. No.
Thank you.
Okay. I have one question, Al. Is that okay if I ask this real quick?
Oh, take your time. As long as the doctor's with us, we can talk.
Okay, my question is for us that have been hospitalized and we've been released. I know they were telling me that my body has produced antibodies, and they said that it would probably be good for 12 months, depending on the severity. So my question is, once, how long should we still pursue getting the shot? And if so, how long that we have been clear of COVID and our faculties have come back to full swing or almost close? Should we pursue getting the shot? So what time frame?
That's an excellent question, because originally the data and the recommendations that came out from the CDC is that if you had the COVID infection, that your antibodies were more effective than maybe even having the vaccination. Therefore, the initial recommendation is that you did not need the vaccination in those severe cases. And the reason why is because you had already gone through such a storm of the inflammation affecting lungs. And when you're doing an immunization, you're trying to also increase the immune response, which also thickens your blood, puts you at personal risk of other issues such as, blood clots and issues with overdrive. So initially the study said not to get vaccinated. The pendulum has swung now where they are recommending to get vaccinated in spite of having COVID as a disease. Now the time frame, I would have to look at it, and those things are being updated daily. So I would refer to the CDC. I would also refer to the World Health Organization and NIH as resources for more up-to-date information, as those time that they are updating quite frequently.
Okay.
But I would say
Okay.
you're going to need it.
Okay.
Okay.
Because I know the different variances are out now. That
They
the
are.
different variances. I don't know if your antibodies will cover those. I know it will cover what you've gone through, but I know that they're saying they have different variances out now, and that the Pfizer and the Moderna seem to be effective on those, and so that's why I kind of asked that to see if go ahead and pursue to get that.
Right. So I think what you should know about any kind of vaccination and any kind of illness, the reason why people get, people say, well, you know what? I don't get the flu shot because sometimes it misses it. When it comes to the flu shot, they're predicting some of those changes that might happen year to year. And so they're trying to predict how they can get a form of an antibody at the shape. They're trying to introduce the particles, not the actual virus, but the actual particles that your body can make memory proteins, so that even if you get the flu, maybe you were going to be 100% bad if you didn't have that vaccination. And this may not be, let's just say we predict that flu is going to be type 7 and type 8, but maybe we got type 8 and type 9 that actually started circulating, where you're going to have some cross protection. And instead of being 100% sick, there maybe 20%. Now I still got the flu, but it wasn't as bad. So we've got to be mindful of that cross protection, which is really, really important when we're looking at how it still gives you added protection. I deal with HPV, being the OBGYN. The HPV vaccination only covers 9 strands of HPV, even though we know there are over 80 different strands of HPV that can be contracted. So we cover the most common types, the most dangerous types that can cause abnormal cells on the cervix. That also protects against penile cancer, also protects against throat cancer. But even though it's 9 little particles that we are protecting, it is still covering and helping with those other strands of HPV. We do have a marked decreased risk of cervical cancer. So any vaccination that we are getting some kind of protection, even though these things are mutating and trying to get smarter, we're going to stick with it. with what we're administering, because herd population control, meaning the more people are vaccinated, the more you protect those that cannot get vaccinated, those that are contraindicated to get vaccinated.
Sure.
The
Sure. Okay.
herd
All right. Thank
immunity.
you.
Herd immunity is very critical with any kind of population
Thank you.
control of a, yeah.
Thank you so much. Appreciate
You're
it.
so welcome.
Okay, Dr. Strozier, this is Al. I have been hearing, and I don't know, I'm just going to ask you the question, that when people can get the COVID-19, that there's usually some type of after effect from it that causes the person's body to be different than it was before they got it. I've heard some say that it could be a memory problem. It could be a fatigue problem, a breathing problem, intestinal problem that they still suffer after they recover from the COVID. Can you give me a comment on that?
Yeah, you're absolutely right. Some people in their most severe cases have chronic lung damage and have to remain on oxygen, or they are continuing to follow with the pulmonologist and having to have more frequent visits to look at long-term damage. You have some people who may have suffered kidney damage during that time, because it can attack the body. It can attack in different ways. And the fact that having thickened blood can decrease blood flow to that kidney, you can get dehydrated. You can have microclots that are just affecting the way that they overall function. We don't know every single side effect, but we do know that we are seeing some lag in how people are healing from some of those COVID related issues. And I think that there are going to be continued studies put out as to the long-term effects and how what's the incidence. We're still collecting evidence on incidence. So.
Well, I know the time has gone by on us. We stayed longer than we normally do, but we had technical problems trying to get in. I'm glad to see Miss. I always get everybody's name mixed up. Yeah, you get ready because you know who I'm talking about. Shy.
Yes.
Glad to have you on here for logging into this. You missed some of it, but this is recorded. I want to remind Dr. Strozier this is her video that she's doing. It is being recorded. She can have the rights to it or whatever she wants to do. I'll talk to her about that. I'll ask if she would you come back with us again on another time so that we can talk to you again and ask some more questions? Because I have a lot more, which I'll probably be able to talk to you personally soon. But I'm grateful for you taking the time out. You have so much going on right now. I'm amazed that you actually got in on it today, and I'm grateful for you taking that time. We had 3 preachers on here today, and Elder Carson, myself, and Pastor Mitchell. Grateful for their attendance. I have about 3 that's from Redemption and Restoration Fellowship. Grateful for that. Thankful for my wife stepping in to be the organizer, and Sister Snea being the organizer. Thank you for that. But I'm going to want you to come back again if you can and address us with some of our other questions. And but as you convene, you can tell me when you can do it.
Pastor Bradley.
Yes, sir.
Yes, I am. Yes, I am.
Okay, after Pastor Mitchell speak, would you dismiss us?
Yes, I just have one, and I there's some scratching going in the background, so I wanted to ask this question and wanted Dr. I don't want to butcher her name, Dr. Stratford?
Strozier.
Dr. Strozier, have you noticed that within the religious community, are you getting support from the religious community as far as pastors asking you to come speak to congregations concerning the vaccine and helping with the vaccine?
I have not personally received any invite specific to COVID vaccinations, it would be essential to have more medical professionals, especially physicians of color, speaking to people of color. We are the most mistrustful of the vaccination, the most difficult patient population to help dispel the myths. There are people who believe that if they get this vaccination, it is the mark of the beast, or they are putting a chip in it, they're tracking my body. They are believing the social media things that they see, because our children are so technology advanced. But it's not just the children, it's everybody reading up, and we are becoming fearful because they keep seeing it, but they are not hearing the facts from the medical professionals, especially medical professionals that look like us.
I just wanted to know, because I am the acting diversity and inclusion recruiter here for the Kansas City VA, and my job is reaching out to the community of all nationalities, underrepresented nationalities,
Yep.
reaching out to those communities through their churches, because we're finding out through their churches, is, that uh, that their pastors, if their pastors take the buy-in and from over the pulpit they address the issue, that people are more likely to take the vaccine.
Agree.
Yeah, here at Kansas City, we used 2 churches, and we were able to get underrepresented veterans as well as their families close to 3,500 to 4,000 shots given. But some of the things from some of the pastors that were trying to talk to other pastors, they were getting some of the same comments that you just stated. They were getting a chip put in. They didn't trust them because of what happened with Tuskegee. They didn't trust the vaccine because they've heard the side effects would make you lose your hair, give you cancer. And I think a lot of the social media that people are reading is coming from Twitter, Facebook, TikTok, but we're hurting our community. How do you suggest that Pastor Bradford and other pastors, how do we convince people that look like us to ignore social media and actually look for true facts from doctors and doctors, clinicians, people who look like us that have taken the vaccine and know more about the education of it?
I think you're definitely hitting the nail on the head. Um, and it is a continued battle for us. But I do think that if you guys are reaching out to the various churches and the leadership, the pastors, and I don't know how you get a congregation to be led if you can't even get the appropriate information to the leadership, because otherwise it's just going to be continued to either not hit the appropriate facts. Maybe it might be helpful to have a panel of leaders, so pastors meet with the medical professions and make sure that they are having their questions answered, making sure that we are seeking God and praying about this. Maybe we start with the prayer, God, how do we address this community issue with our people of color that are not represented as well, and making sure that the leaders, the people that people trust, are also having the appropriate facts, are also being able to have healing. I mean, we have a lot of trauma. We have trauma in the Black community, trauma from, and this, what you're saying is critical. We're talking about COVID because that's right now what's the heightened pandemic that we're dealing with right now. But honestly, there's so much more. This question you asked is really multifactorial. I see Black women suffering in childbearing. That's a national thing. The way we support people, the way that how many people say, "Oh, I don't go to the hospital. I'm not a hospital person." I see so many individuals in the hospital suffering alone because who should be their support people are traumatized, almost like PTSD. Maybe they had a bad situation where grandma died in the hospital, or maybe the last time they were in the hospital, so-and-so got shot and died, and I can't go back in that hospital. So the people that should be your support system have undealt with trauma, and they can't even be a support to the people they're supposed to be supported to. I was mentioning this and talking with some other physicians. I had a GYN oncologist. He's a white male, and he said, I was talking to him about some of the issues I see with Black women in their health care while they're pregnant and while we're at high risk. We don't support sometimes the appropriate way what the needs are. When we look at different nationalities, different races, we don't do this support thing correctly, and a lot of it is just repeated generations of mistrust and also undealt with traumas when it comes to healthcare. Maybe so-and-so treated them badly. We have got to figure out how we target and penetrate people that are underrepresented and instill faith and instill trust, give them a voice as to what kinds of questions they should be asking, give them a voice to say, you can have help. But if you shut down and you can't get questions, or you leave a loved one without support, they're the ones that are sick. So back to this GYN doctor, he's an oncologist. He said, I went to the waiting area. I just had 2 Black women that I just did their uterine cancer surgery. And I went to talk to their husbands, and they weren't there. And I went back and talked to the wives, and they said, yeah, my husband's at home. He said, but COVID pandemic is, we've opened up the waiting area. So they could have come to the hospital, let you know, we want to make sure that they could be here. They said, oh, my husband would not come. They don't do hospitals. So when I look at the support that we are doing for each other, we are still struggling. And it's not just, it continues to be passed down generation to generation. So we have to educate. We have to do a whole reforming, a renewing of our mind and a renewing of our culture. This whole thing with cancel culture, no, we're about to reinvent culture, and we are going to do this thing better so that we can help each other, and we can be more present and more meaningful, more mindful, and more stable as a Black and brown culture.
Thank you so much. Thank you so much.
Reverend Bradford,
Yes.
if I may, humbly,
Mhm.
just kind of share maybe 30 seconds. Just in the community from education, because I'm a teacher in Kansas City, Kansas, and I do know there are some churches that have set up COVID vaccine sites at their church, and members, and they're people of color, and those members have gotten shots through that. So I don't know if that might be ideal for other churches, or maybe there might be a summit among pastors, and maybe the pastors that believe in these vaccines and that their congregations can be vaccine, that they could set up sites, and maybe they can rotate so that that the people that are not being reached can go, because you can actually get the vaccine free. The people that are getting the vaccine using their insurance, but these vaccines are free.
Yeah, that's a conversation that we need to have. That's what Pastor Mitchell was referring to, and that's what Dr. Strozier is referring to that we need to do. So in order to get something accomplished, you have to have a plan. Somebody's got to start it. That's why I would like for her to come back. And in case, amen. And I appreciate
I do
that.
believe that Pastor Carter at Salem Baptist Church did the vaccines there. And I think Turner also at Oak Ridge did them. So we did have at least 2 churches and pastors that I know that did do the vaccines at their actual churches.
And there are some that are doing positive work in that line. There's a key that I'm hearing here that I'm trying to wrap my head around because I'm one that was not, I've never had none of these shots any of y'all are talking about. And I haven't been sick behind them. I've been blessed.
How do you know?
However,
I want to know, Uncle, how do you know? How do you know you've never had these vaccinations? Because somebody told you?
wait a minute. What was the question?
How do you know you've never had these vaccinations?
Well, right now you tell me I can't trust the doctor. Well, one of them, I don't go to the doctor.
But
The
I'm
one,
saying
the
in
book,
childhood, you should have had
oh,
polio
yeah, what,
vaccination, MMR, tetanus. We
yes,
saw,
yes.
yeah,
And that's true. That when I was young and didn't have no right to speak for myself, I did. And I'm not against that. That's not a problem. The point that I'm trying to make here is, because I got a whole lot of things I can say about why there's a distrust in the Black community. But right now we have an emergency. So the thing that I'm addressing here is the points that you have made. And the one thing that helped me, I listen to you more because, number one, you're family. Number two, you are a qualified doctor. That does make it easier for me to understand what's going on. And I'm falling on the word that you used earlier, the trust in your physician. So that's why I'm listening to you, and I can hear the results and things that need to be done. I'm not here to rock the boat to cause any problems with people doing what they need to do, because that's between them and their God. But we do have the responsibility to tell the truth. The truth that we run into is many of the people we have trusted have lied to us. That's why we don't trust people. And we need to be able to regain a trust if it's no more than just amongst ourselves. So we have a tribal problem because the tribe that we have been raised up in, the tribe itself is sick. And we need leaders such as yourself who are willing to take and stand out like you're doing now, bring the truth, tell us what we need to do and how to get there. And I'm putting a load on you because we trust you.
right.
I've been through things. So the community trust, and unfortunately, men is one of the worst aspects when it comes to family leadership and what to do, because we don't know. And that's why I try hard to learn for myself, to rise above those things that I suffer from, lack of leadership and the truth around me in my previous years, to be better. And I find out I have to do that by educating myself and not by what I just heard. Because there's a lot of things I've learned in school that I have found out when I got older that it was a lie. And that's how we have been whitewashed from the Bible things in the past, because we've been lied to so much. Now, that may have been a historical problem, but the answer is still there, but we have to look for it.
Right.
And I'm looking. That's why you're here. I'm picking your brain. I do want to be supportive. Elder Carson, another messenger, he's going to come through it. He can tell the truth and tell you the pros and cons. If we don't get our men straightened out on what to do with the family, it's not going to improve, because the men are the leaders of the family, and men need to get this straight first above all others, so that we can properly lead our wives and lead our children. We got to straighten it up. It's our fault. It's not the women's fault. It's our fault. So yes, you're here to help me as well.
Okay.
I just wanted to say in conclusion, within 10, I'm gonna try to do it within 10 sections, is that the churches that have, because there are numerous churches around the city that have held vaccines, and they've been well attended and well used in our community. However, there is a large majority of pastors that are talking against, not only to their congregation, but the community, against the shot. No matter what, Moderna, J&J, Pfizer, they're talking against the shot. They're talking against the shingle shot. These are messengers that people have placed their trust in because they wear a collar. They wear a title called pastor, minister, evangelist. That's a danger in our community. And that's what I was speaking to. We have to fight this spirit of propaganda that's against our community. We're enslaving our people to falsehood that not only is endangering their lives here on earth, but we're also endangering their lives everlasting. And that's the doctor was so profound in speaking that it is a community curse. It just does not deal with the COVID vaccine. It deals with oncology. It deals with men having cancer, breast cancer. It also deals with various other types of cancers. And because we were so many years, we're still in that stigma. When we say the C word, people whisper. They don't want to say that they have cancer. Just like when HIV hit, we said it wasn't in our community. It was mainly a white disease. And when it hit our community, we started calling it the package. We have to begin to come out of these stigmas across the pulpit and address issues that address the community. My son puts it this way as I conclude. My son puts it is that we know that Daniel was able to live in the lion's den and did not get bit. However, in our community today, we're in the den, but the lions are biting because of falsehood.
Powerful.
All right.
Yeah.
Well, I thank everybody again. I appreciate it. Sis, if you would, you tell me when you can come back, and I'm going to jump on this quicker to get a more of an announcement of your appearance with us. And but I will not try to zero you in on any specific time. You're welcome to come whenever you want to. Just let us know in advance, and we will get you squared away.
Okay, will do. I definitely thank you so much for this opportunity to talk with you, and we'll definitely do it again.
I appreciate that. Thank you so much. Love you for taking the time.
Love you too. Love everybody.
I know I woke you up from your nap so you can come on. I hope you're able to go back to sleep and get you some rest.
I will. Trust me. Thank you.
That's right.
Yes, sir.
You want to dismiss us?
Most gracious Father, we're so thankful for our speaker on tonight. We're so thankful for the words that you've given us to help us to understand the situation in which we are in. Help us to open up our eyes, our minds, and our hearts to understand what has been given to us to make our lives better and more healthier. Asking you, Father, to help this doctor